Ashton, we are still keeping our eye on the other developments having to do with this pandemic, including this Delta variant that's on everybody's minds. And again, you've talked about this a lot. There are things worse than death, I think, is how you've phrased it. But we're still learning more about some of the issues that still, medical issues that still come from having COVID.
Exactly. So it's not just the risk of infection, you guys, but now we're learning more about the risks after infection. So a recent study, this is the largest report and study to date of nearly 2 million people who were infected with COVID-19. They looked at insurance records and found that 1 month or more after their infection, 23% sought medical attention for new or persistent problems. These are patients of all ages, all severity of COVID, including the mild or asymptomatic cases. And what are we talking about? We're talking about things like nerve and muscle pain that's severe, difficulty breathing or respiratory problems, fatigue, body aches, even high blood pressure. So again, this serves as an important reminder. It's not just the acute infection that we have to worry about here. It's long term.
Yeah, the long term physical repercussions of getting COVID. But there's another medical headline that has been getting our attention, and people are calling this the second pandemic. It's the mental health toll of what we've all been through.
Yep, and particularly on the pediatric age group. So Children's Hospital of Colorado issuing a state of emergency for the first time in their 117-year history, 72% increase in pediatric emergency room visits, you guys, for things like severe anxiety, depression, suicidal thoughts in children. Their chief medical officer saying, and I quote, "Our kids are out of resilience. Their tanks are empty." This serves as an important reminder. If there is a child or a teen in your life, check in with them, really ask how they're doing. And if you think they are struggling or if they tell you they're struggling, get professional help.
Yeah, and speaking to that, Dr. Jen, it's a good time to remind our viewers, if you or a loved one are struggling, please call the National Suicide Prevention Lifeline. The number's there on your screen, 1-800-273-8255. You can also text TALK to 741-741 for free, confidential, emotional support. This is available 24 hours a day, 7 days a week. Even if you feel like it, you are not alone. Dr. Jen, thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.